All right, we're live.
Hi, welcome to the COVID313 Coalition for Families and Students. We want to hear from you. Chat your comments or questions on the Facebook to get us started. Welcome again. My name is Rita Seves, and I'm Communications and Marketing Specialist at Chas Center, a proud member of the COVID313 Coalition. Before we get started, in the comments, please let us know where you're joining us from. How did you hear about the town hall? What topic you are most looking forward to hearing today, and what other topics you would like to hear from us in the future. We will be hosting these town halls monthly. So our next town hall will be next Thursday, November 17th at noon. We will have closed captioning today, and we'll be translating the town hall into Spanish. Cristina, can you please tell our viewers how to view the town hall in Spanish?
Good afternoon, buenos días. Si quieren escuchar la charla de COVID313 en español, por favor vayan al Facebook Live de Urban Neighborhood Initiatives o UNI, o hay un enlace adjunto en el chat. Gracias.
Thank you, Christina. For our experts today, please remember to speak slowly for our translators. They want to make sure that they are translating the important information that you're sharing today. Marty is our timekeeper, and he will chat with you during the conversation to let you know the remainder of the time. And to start us off with our panelists, we welcome Jametta. Jametta, welcome. I give you the floor.
Thank you so much, Rita, and thank all of you for being part of another COVID313 Community Town Hall. Dr. Abdul El-Sayed, it is a joy to see you. I was sharing with people about how excited I am about today's program, and in particular to have you as not only a health equity warrior, but also the incredible and important role that you have played about articulating what's so important about this particular election in this point in time of our history. So I'd love to have the opportunity to hear from you and to share with our broad audience, what are the things that you think are so important for us to focus on as we think about this upcoming election cycle?
Well, Ms. Jametta, first, I just want to say how grateful I am to be joining you, grateful for your work at the Detroit Parent Network and your leadership in our communities. This is a critical election. I know people are tired of hearing that. This is the most important election of our lifetimes. Well, unfortunately, it somewhat is. And the reason why is because the democracy itself, the ability to self-govern, feels very much on the line. We cannot forget the context of this in 2020, an election that was contested insofar as it was the first presidential election in American history where an outgoing president who'd lost to the election denied that outcome. And right now, we are in the thralls of a conversation about whether or not that ought to be the way that we choose our leadership. There are a lot of other folks who are lining up and running for offices, whether statewide or local, who believe that the election was not fairly contested, despite all evidence suggesting that, in fact, this was the safest, most secure election we'd ever had. That and the fact that there are some major issues on the ballot. In the summer of just this past year, the Supreme Court ruled in a case called Dobbs v. Jackson Women's Health, which undid over half a century of precedent, taking away the right for a person to choose whether or not to carry a pregnancy up until the point of viability. And then beyond that, we are in this moment where a pandemic is still ongoing and the economy is somewhat teetering. We have inflation that we have not seen for the past 4 decades, and a moment right now where the stock market is suggesting that we may be headed into what most forecasters suggest could be a mild recession. So there's a lot on the ballot right now, and a lot that voters need to vote on, particularly here in Michigan, where our governor, our secretary of state, our attorney general are all up for re-election. The entire state legislature is up for re-election, both the House and the Senate. And we have three really critical proposals, not to mention Congress in all of the down ballot races that are so critical, but sometimes we don't pay as much attention to.
You know, you mentioned something about context again, because context is everything, isn't it? We say over and over again, every election is important, but why in particular? You mentioned about both the national as well as within the state of Michigan. Could you talk a little bit about, as people are thinking, why is the Michigan election right now so important when we think about governor, when we think about attorney general, the secretary of state? What is it that people really need to connect the dots? And how do those dots, let's just push in another thing about context. How does this election and the reality that we have come through and are in fact still in COVID, what do you think the implications of all of that are together?
Yeah, this has been a really tenuous past several years in this country. And right now, every single state office in Michigan, every single one that is a political office, the governor, the secretary of state, the attorney general, the entire state Senate and state House of Representatives, all of them are up for re-election in this election. So in theory, all of state government could change over. The challenge right now, though, is whether or not we are willing to change the guard in a moment when we've seen our state create almost an unprecedented number of new jobs, in a moment where we are still battling a pandemic, despite the fact that a lot of folks just want us to move on. In a moment when we are watching as basic rights are being stripped of people. And the question of who we hand power to is critical. We have Governor Gretchen Whitmer, who is running for re-election. She is running on a platform that is focused on continuing to create jobs, continuing to rebuild infrastructure, but probably more fundamentally in this moment is to protect basic fundamental rights in Michigan. We have a law on the books that would make pursuing or supporting an abortion a felony. That it goes all the way back to 1931, so almost a century-old law that's still on the books. And we have a governor right now who wants to protect the right to an abortion and continues to fight for that. And then when it comes to the Secretary of State, this is the chief elections officer of the state of Michigan. And you have Jocelyn Benson, who by all accounts ran one of the cleanest, most effective major elections in the 2020 cycle. And she's up against somebody named Christina Caramo, who's new to politics, but really is running on this notion that the election was rigged, which again, there is zero evidence to substantiate, and is based on a set of conspiracy theories largely driven by the former president of the United States and Donald Trump. And then when it comes to the attorney general right now is Dana Nessel. She's running for re-election as well. And she is the chief law enforcement officer of the state of Michigan. And particularly when it comes to the question of basic fundamental rights, that office has critical responsibilities to play. She's running against an individual named Matt DePerno, who was involved in a number of conspiracies to steal an election machine and have it opened up in the last election, and also believes that there are no exceptions to a full abortion ban, supports that 1931 law. And so there's just a lot on the books. Meanwhile, we had a major redistricting. And so for folks who don't understand what redistricting is, every 10 years, the census numbers are analyzed and they redraw the lines that dictate what the state legislative and federal legislative lines are. So, all of the Congress people, all of the state senators and state representatives, the districts that they represent are a function of these lines that are redrawn. So those lines have been redrawn, and they were redrawn in accordance with a new process. In the past, the state legislature used to just draw the lines. Now there is an independent commission that was selected to choose the lines. And so in the past, oftentimes the party that was in power, which was Republicans, would redraw a set of lines so that they would benefit Republicans. Now we have new lines. And so there's just so much to be voting on, because we finally have the opportunity to vote in districts that are not what we call gerrymandered, meaning drawn to pack or crack people, particularly people of color, into certain districts to advantage one party over another.
Yeah, so you have, I think, amplified how important this particular election is, and how really having a focus and an understanding of the leadership, or perhaps the lack of, that we see in many cases. So before we get to questions, Dr. Abdul El-Sayed, you're not only known now nationally, I think we knew you a little bit a while in Detroit, where you were just pretty outstanding as our public health officer. So welcome, and it was a joy to see you there. I'm wondering, however, as I said, you moved nationally. Could you share a little bit about what have you been involved in nationally as relates to, in particular, the issues of health equity and our voices being heard politically?
Well, Mr. Mehta, it's kind of you to say, and it means so much coming from a leader like you. I miss my work in Detroit, and I miss being in the community and working with the folks that I get to serve. My work now is focused on policy advocacy, mainly toward policy that dignifies the bodies of everybody, particularly people who have been left out of our systems, particularly Black and brown folks. And you see that on the ground in communities like Detroit, in communities all over our state, where our children are forced to breathe air that's come out of smokestacks in highly industrialized communities because of zoning that disproportionately degrades and discounts their humanity. You look at the quality of roads in different communities. You look at the quality of water, particularly considering the fluent water crisis. And all of this comes from a set of public policies that tell us that the only thing that really matters is whether or not a major corporation can make a lot of money off of a particular policy. And so a lot of my advocacy has been about trying to make our public policy work for people rather than the profits of corporations. That's come in the form of written a couple books, one called Healing Politics that came out, terrible timing, right before the pandemic kicked off in 2020. Wrote another one called Medicare for All, A Citizen's Guide, with my colleague, Dr. Micah Johnson, trying to lay out what it would look like to build a universal national guaranteed health insurance program for everybody in our country, and what that could mean for folks, particularly in terms of health care access. But then I also write quite a bit. I'm a contributing editor at the New Republic, and I write a newsletter called The Incision, which folks can check out at incision.substack.com. I also work as a political commentator for CNN, and I host a podcast called America Dissected, where we look at the juxtaposition between health and society. And then I do quite a bit of advocacy on YouTube, where it gives me a platform to sort of ask and answer big picture questions about where our society is headed, and folks can check us out there. But I stay engaged. And then lastly, I teach at the School of Public Policy at the University of Michigan, the Ford School, where I teach mainly on health policy and political advocacy. And so it keeps me busy, but always with Detroit and Southeast Michigan and Michigan in general in my heart, and the lessons that I've learned being taught by folks like you, Mr. Mehta, and trying to offer them a bigger platform to advocate for the kind of country that we need and we deserve.
Well, I have to tell you, so you've humbled me with your compliments. Thank you so much. And I have to laugh. I'm chuckling when you just listed all those things that you do. So I used to like to joke that I do 72,000 things. I think you just blew it up. It's like you do 172,000 things, and you do them with excellence. And that's what so much of what we need. I'm wondering, can you, just before and I know you have to wrap up to move on to your 172,000 wonderful things to do. Could you talk a minute about how, with the voting that we're seeing, and the issue of accessibility, what's different in Michigan that we have the rights to as a result of our leadership, perhaps than what we've seen that's been proposed in places like Georgia? What do people in Michigan need to know about what rights they have to assure that their voices will be heard?
Yeah, well, for right now, you can early vote, and that means you show up to your town hall and ask for a ballot, and you can go in, you can register your vote today. And then, of course, we have voting on voting day. And that is going to be, as it always is, that Tuesday, November 8th. The other piece of this is that if you've registered for an absentee ballot and that ballot has come in the mail, make sure you fill it out. You can either drop it off at your town hall, or you can stick it in the mail, and it'll get counted. The thing I want folks to understand, though, is that voting itself is on the ballot. And I don't have to tell you, Mr. Mehta, that the right to vote, the opportunity to vote, access to the vote, has been one of the most important questions in American history, particularly as it pertains to Black folk and brown folk. And there has been a concerted effort to take that vote away in the name of making voting more secure. But when they make voting more secure, what they're trying to say is that they assume that when people who look like you or people who look like me come out to vote, that somehow our votes should be assumed illegal until proven otherwise. And we have a proposal on the ballot this year, Proposal 2, which is really about guaranteeing secure access to voting and making sure that you can vote early, 9 days up to Election Day, making sure that you have access to absentee voting by mail, making sure that nobody is going to ask you for an ID at the point that you come to vote, which is in fact illegal as it stands right now. And making sure that everybody's vote is heard. And I want to remind folks that your vote is sacred. There have been many people, many of our ancestors who fought and died for the right to vote in this country. And to know that in 2022 there are people who want to take it away from us should make us want to use it all the more. And so I'm hoping that folks will show up. Will register their stake in our democracy. We'll remind people what it means to lift our voices and elect our own leaders, and demonstrate that, in fact, the democracy is here to stay, that democracy is worth fighting for, worth saving, worth investing in, and worth putting our time in. And the last thing I just want folks to remember is that, for me, my folks immigrated to this country from Egypt. Egypt, there is no democracy. You don't get to really vote and choose your leaders. And for all of the challenges, bringing this country to its highest ideals, actually achieving equity and justice, I think a lot about every time I fill out a ballot, what it means to be able to choose my own leader, what it means to have been able to even run for office, as I did in 2018, as somebody whose name is Abdurrahman, whose family is only one generation in this country. And that's something we've got to continue to fight for everything that we want, for more just, more equitable, more sustainable America. Every piece of that runs through the vote. And so let's not take it for granted. And I know everybody watching right now is going to go out and vote if you haven't already. But what I'm asking you to do is talk to your aunties and your uncles, talk to your grandma and your kids, talk to that brother, that sister, folks who are working 2 jobs, who feel like they just can't make it work, and remind them what's at stake in this election. Because when we come out and vote, when we voice what we deserve as a community, things really can change. And so, I'm counting on you, you're counting on me, we're all counting on each other. And that's what democracy was supposed to be about.
Absolutely. And at the core of that democracy is having an informed and literate populace that understands that freedom ain't free. It takes us working together, and that we have rights and we have choices that we can make. And that means around our health, our reproductive health, where we send our children for school, how we lift up and move our families forward. Dr. Abdul El-Sayed, thank you so much for spending a little bit of time with us. We hope that we can get you back for some more conversations. And in particular, maybe one of the things that you'd be interested in is we have wonderful young people that have been part of our COVID313 Community Coalition. So as I'm thinking, we need to have some dialogue with your generation and their generation. So how are we going to get the equity and the America that we know that working together we can strive for? Thank you so much for being with us.
Thank you so much.
Take care and be blessed. Okay, thank you. Well, I hope again that as you are listening, you are fired up. I want to thank my team for kicking us off, and that we're fired up and we need to better understand, well, what actually is on the ballot. We've been reminded that literally everything regarding leadership in the state of Michigan is up for our votes. And that means that we have to be aware and ready. So to help us to be aware and ready is some of our own members of our own team. And as you all know, our team is made of some dynamic men and women from all parts of the city. And I'm so pleased to ask Akila Montakim, who is the Deputy Director of Mothering Justice, which is all about making sure in particular that women, and particularly Black women, are fully informed and have control and agency over their bodies and can be the dynamic women they need to be for their children and our collective future. But in order to make that happen, Akila, we got to make sure that we're voting, don't we?
Absolutely. And thank you so much, Jametta. I'm going to share.
I'm going to kick it to you. Inform us, please.
All right, thank you. So now we're going to talk about what is on the 2022 Michigan ballot. And we're going to focus in on those ballot proposals that can be a little tricky when you're trying to read them in a hurry in that very tiny voting booth. The first proposal on the ballot is Proposal 22-1A, which is also known as Proposal 1. This is exactly how it will look on your ballot. So just be prepared to either flip it over to the back or look for the proposal section so that you can make sure that you cast your vote either way for these proposals. Now, this proposal would allow or will require all state lawmakers like our governor, lieutenant governor, secretary of state, and attorney general to disclose certain personal information, including a description of their assets, all of their income, liabilities, payments, gifts, and other benefits from former and future employers. Currently, Michigan is one of 2 states that does not require this, and financial disclosures are only required from these elected officials. Candidates, spouses, and family members do not need to file. Another part of this proposal talks about changes to the structure of the term limits for state representatives and state senators. This does not impact term limits for any other offices. Currently, they are allowed to serve a maximum of 6 years, which equals 3 terms in the House, and 8 years, which is equivalent to 2 terms in the Senate. This proposal, if you voted yes, would reduce the number of allowed years from 14 to 12. All 12 of those years could be served in one chamber or divided in any combination. Term limits are not impacted by redistricting or relocating. So what does that all boil down to? If you voted yes, Proposal 1 will replace 1994's Proposal B and the state legislative term limits that went into effect with a new requirement of a combined 12 years in the state legislature. This ballot measure would make an exception for people elected to the state Senate in 2022, and those individuals would be allowed to still serve the 12 years regardless of prior legislative office, such as being a member elected to the House. So if you vote no, of course, you're opposing this constitutional amendment, and we're just going to continue on with things as they have been. So just make sure that you're fully aware of what that yes and no means. Try to break it down. And if you want to check it out for yourself, ballotpedia.org has all of this exact same information available to help you make your decision. Now we're going to move on. Oops, sorry, y'all. To Proposal 22-2A, which is also known as Proposal 2. Now, this is also a proposal for a constitutional amendment, and this will require the state to fund things like prepaid postage for voters to return absentee ballot applications and absentee ballots. It will require military and overseas absentee ballots to be counted as long as they've been postmarked by Election Day and received within 6 days after the election. It will also prohibit any political party officers from having a role in directing, supervising, or conducting audits. So what does really all of this mean? Supporters of Proposal 2 say that it does protect the military vote. It supports voting rights for organizations and activists. It protects current voting rights for all of us. And it protects voters from attempts to enact any voter suppression legislation. Opponents, on the other hand, say terms like harassment, intimidation, and interference aren't really defined, and that there are no funding sources identified for this either. But what does that mean for you? If you, oops, did I click the, sorry, y'all. Trying to click through these slides. If you voted yes, you are saying that you support adding several election and voting related policies to the Michigan Constitution, like creating a 9-day early voting period, allowing for a signed affidavit or photo identification to vote, requiring that military and overseas ballots that are postmarked by Election Day and received on time are counted, and then also providing voters with a right to request an absentee ballot at any time. If you voted no, then again, you would just want everything to stay as it has been, and we will continue on allowing the legislator to pass bills to change these policies in the future. Finally, we've got Proposal 22-3A, also known as Prop 3. Now, Proposal 3 is specifically related to the right to reproductive freedom. Hold on, give me 1 second. I'm sorry, y'all, I keep losing all my stuff. The right to reproductive freedom is defined as the right to make and effectuate decisions about all matters related to pregnancy, including but not limited to prenatal care, childbirth, postpartum care, contraception, sterilization, abortion care, miscarriage management, and infertility care. This ballot initiative will provide that the state can regulate abortion after fetal liability, except that the state could not ban the use of abortion to protect the life or physical or mental health of the pregnant individual as determined by an attending healthcare professional. Now, I know if anybody is like me listening to the radio in the morning on the way to drop the kids off to school or head to work, you might hear some commercials on the radio that are talking about the impact that Proposal 3 may or may not have on parental consent laws. So I want to take a moment to debunk some disinformation. There is currently a legal precedent supporting restricting the rights of minors. For example, while we all have the right to purchase and own and operate firearms, this right is restricted for minors. The state maintains that we will continue to have a compelling interest in regulating healthcare professionals, and all ethical and professional standards will still apply as it relates to restrictions for minors. That just means that this proposal will not impact current parental consent laws. Now, post-viability abortions are exceedingly rare as well and occur in extreme circumstances such as an imminent threat to the mother or birthing person's life or severe fetal anomalies. Only 0.025% of abortions occur in the third trimester, and this includes cases where the fetus is not viable. Proposal 3 essentially provides the same protections that we've had for 50 years under Roe versus Wade. Despite any critics claiming to the contrary, passage of Proposal 3 will have no impact on gender-affirming care, statutory rape and prostitution laws, human cloning, dilation and evacuation procedures, laws about who is allowed to perform abortions. So a yes vote for Proposal 3 would support providing a state constitutional right to that reproductive freedom that we talked about, which again is defined as the right to make and effectuate decisions about all matters related to pregnancy, including but not limiting to things like prenatal care, postpartum care, and contraception. A no vote would oppose providing a state constitutional right to reproductive freedom. A yes would also repeal the 1931 law that bans and criminalizes abortion. And the only exception in that law is to save the life of the pregnant person. A yes vote will also affirm the right to use permanent and/or temporary contraception, like the Depo-Provera shot. No one could be prosecuted for having a miscarriage, abortion, or stillbirth, or for providing abortion services or helping someone procure one. A yes vote will also make sure that the state retains the ability to regulate and restrict abortions after the point of fetal viability. And because there is no predetermined number of weeks for fetal viability, this will also protect viable fetuses as medical science improves. The state cannot ban abortions at any point if it is to save the life of the mother. Fetal viability and saving the life of the mother or birthing person are determined by healthcare professionals. Again, that is what would happen if you did vote yes for Proposal 3. If you vote no, again, we would just keep everything as it is, and that 1931 ban will still exist. This is just a little bit of information. Thank you to Nomi Joyrick, who is the director of Michigan Jews for a Secular Democracy and also an organizer for the Michigan Unitarian Universalist Social Justice Network. Thank you, Nomi, for putting together so much great information about these proposals. Also, Ballotpedia and the Michigan Department of State's voter information website. This is where you can go to view your specific ballot, because there are other things that are going to be specific to your county or where you live, like elections for your school board, millages, and different things like that. But thank you all so much, and I'll pass it back to you, Jametta.
Hey, thank you so much, Akila. And also to give us a little bit of more information for our Get Out the Vote before our next segment on health is Arlisa Hurd. It is the Arlisa Hurd with 4824. It's wonderful to have you back with us. Arlisa?
Thank you. Hi, everybody. My background is noisy, so please forgive me. I left my headphones. But anyway, let me know if you can't hear me or if it's too bad.
Yeah, we can hear you fine.
Okay, good. Hi, everybody. So I am just here today because today is the absolute big day where we are going to put in the room at least 15 of the 18 DPSCD school board candidates. We've already got at least 15 confirmations. They're going to be there. This is an opportunity for folks, voters. You don't have to have a kid in the school just to be able to vote on the school board, right? Because education impacts us all. Whatever impacts the family impacts the community. So we would like to see everyone who can come on out to come and hear what the candidates have to say. We are going to allow questions from the audience. I know a lot of times, some of these forums, sometimes you can't get your opinion in, or you can't ask your questions, but we're going to allow it. So that's why we've got 2 hours of this time. Come on out. We've got childcare activities available. If you have kids, you can just bring them out, put them in the childcare room. We've got the professionals that are going to deal with that. We have refreshments, and come on out and ask your questions and see who is trying to run for the top spots in the Detroit Public School Board. I don't know if there were any other questions or anything, but that was pretty much all I wanted to share. And also, by the way, I just wanted, while I'm here, I'll just do this. Now, there's a flyer up on the screen right now, and you can see there's this little bit of blurb right in the middle that says, did you know that only 12% of Detroit voters voted for a school board in 2018? Did you know that?
Yeah, only 12%.
Only 12%.
Out of the tens of thousands of families who have children in Detroit Public School Community District, only 12%.
Yes.
Okay, we got to get busy.
We got to get busy. And so I'm laying the charge on us, folks. Long gone are the days where you just go in there and close your eyes and just start checking off people. Don't do it. All of the information is here. I really liked what was said right before I came on about the Ballotpedia. You can check it out. What's on your ballot? There is a way. All of us walk around with a computer in our hands. That's our phones. You can find out anything you need to know. Take a little bit of time and do some research on people. Look it up. See what this is all about. Don't vote blindly. We want you to come and vote, but we also want you to be an educated and an informed voter. So please, once again, tonight, 5:30, Focus Hope in person. Detroit candidate for school board in person. And we're doing it safely too.
Okay, Arlisa, thank you as always. It's a joy to have your voice, and for 4824 to continue to lead about helping the community understand critical issues, particularly around education. And just like we are about completely with COVID313 Town Hall, we are always educating, informing, education, social justice, basic needs. And what brought us here in the first place? Well, we all remember. It was the middle of March 2020 as COVID. So it's really important, and I'm delighted to shift our conversation back to talking about health. And it's so important, and we are just so excited and delighted to have Dr. Natasha Bagdasarian. Dr. Bagdasarian is the not only a fabulous and an expert both in international medicine, she is the leader of our state and serves as the Chief Medical Executive. Dr. Bagdasarian, welcome to COVID313 Town Hall.
Thank you so much for having me on. It's a pleasure to be with you today.
It's a triple joy, and I'm just going to take a slight privilege. For those who may not know, I certainly have been honored to serve on Governor Whitmer's Coronavirus Racial Disparities Task Force. So I can say that I have had a chance to witness you not only bring your lens as a physician, but also to bring your compassion for people and your willingness to be accessible. So what I'd love to be able to do, so hold tight, everyone, we're going to talk about the variants. We're going to talk about monkeypox. We're going to talk about children's COVID vaccines. But I thought it might be interesting, Dr. Bagdasarian, could you share just briefly, you've been working at one point, you were at the World Health Organization, and you were actually overseas in a particularly interesting place. How has that informed your perspective and how you've been trying to make sure that us in Michigan are safe and healthy?
Well, thank you for asking. I do love talking about some of these experiences because they have informed some of the way that I approach COVID-19 and other infectious diseases. But I took some time after working in Michigan for a number of years to move overseas with my family. And I was actually working in Singapore when the pandemic first hit. So I was working in Singapore. I was actually living in Dubai, which is a whole nother long story, flying back and forth. But I got to witness responses in two other parts of the world. I got to see how Singapore first handled COVID-19. And this was a country that had been hit hard by SARS-1, the first SARS virus. This is our second SARS virus. They had been hit by SARS-1. And so they had a lot of things that were just ready to go. And it was it was actually a beautiful response to see because there was a lot of caring and community feel to this response to COVID-19. And then I also got to see what was happening in Dubai, which we were under a very strict lockdown in Dubai, nothing like anyone here in Michigan has experienced, where we needed a police permit to actually leave our apartment. So I got to see what things were like on different parts of the world and moved back to Michigan in July of 2020 and got to see again what was happening in Michigan during those early months of the pandemic. So it really informed my approach to the pandemic. And I got to see so many different ways of dealing with this virus. And throughout this time, throughout 2020 onwards, I was working for the World Health Organization and also putting together some guidance for them on pandemic preparedness and response. And it was really an interesting thing to do because I was thinking about COVID, not just from the lens of here in Michigan, but also the lens of how are other countries dealing with this, countries without all the resources we have. So it has been a very interesting time, but of course, this virus has hit everyone in different ways. Here at home and in other parts of the world, I think we have all been affected by this virus and by this pandemic. It is a source of common, a shared grief that we have been through and how our world has changed over the last 2.5 years.
I really appreciate you mentioning that latter part because so often as we talk about the things that we don't like or mask mandates or don't do this, we're forgetting that we've all been impacted and that the grief and loss, some of which we are prepared to talk about, and for many of us, we're sublimating it, we're repressing it, but certainly we need to talk about that because our heads and our bodies and our hearts are all connected. Could you talk to us a little bit? So, here we are in October, soon to be in a holiday season. But before we even get into that, where is the state of Michigan from your perspective relevant to COVID? And what has the state been recommending specifically in the context of the new variants? But first, what's our temperature as a state?
The temperature is pretty mild. So we have been sort of coasting along. Cases are not low, but we've been coasting along for the last several months now. And Michigan has been very lucky that we missed the surges that they saw down south with those new subvariants, the BA4 and BA5 subvariants. So we did not see those upticks that many of the southern states had over the summer. We've kind of coasted through the summer, and a little bit to my surprise, we have been coasting through the fall so far. What we are seeing now is we are starting to see a lot of viral respiratory illness, not necessarily COVID. So there's still COVID happening. There's still a lot of people who are testing positive at home. There are still some people in the hospital, But in terms of COVID, our tools are really working. And where I see that is, even though there are people with COVID and even though there are people with COVID in the hospital, we are not seeing those folks in the ICU and we are not seeing them on ventilators. And we're also not seeing them die. So the tools that we have today in October of 2022 are working. And that is really, really positive news. But I want to talk about a couple of other pieces. There are other viruses circulating. And we are seeing an uptick in two viruses in particular. We are seeing an uptick in cases of something called RSV, that's respiratory syncytial virus, and it predominantly affects the little ones, little kids. And we're also seeing a little bit of an uptick in influenza as well. And so that means that right now, and just in the last few days, we've been hearing from our pediatric hospitals that they are under stress, that their waiting rooms are getting filled again, and that some of their ICUs are also filling up. So not necessarily COVID, because we've got some tools, but some other viruses. Now, when I look forward as to what's going to happen in December and January, we are expecting there to be an increase in COVID cases as well. So this could be an uptake of COVID plus these other viruses, making for a busy season in hospitals. And when I talk to the public in forums like this, and by the way, thank you for this opportunity to talk to your viewers, one of my messages is have a plan for this respiratory season. And there are 4 components to this have a plan. The first is find out if you are a candidate for a vaccine or a booster. So that's COVID vaccination, COVID boosters. We've got a fabulous new booster, the bivalent booster that is protecting people against the current circulating strains, but we've also got flu shots. So those shots are the first pillar. Second is keep a supply of masks at home, because if you do feel sick, you might not be masking everywhere you go, but if you feel sick, it's one of the best things you can do is put a mask on and stay at home so you're not infecting other people. The next pillar is keep a supply of over-the-counter tests at home. So right now we don't have over-the-counter tests for all of these viruses, but we certainly have over-the-counter tests for COVID. So you can test as soon as you develop symptoms or after you've been exposed, and that way you're keeping other people safe around you. And lastly, talk to your doctor to find out if you are a candidate for one of the therapeutics or treatments we have. We've got treatments both for influenza and for COVID-19. And that way, if you do get sick, you know where to go. You know that you're a candidate for one of these treatments and you can rapidly access a clinician and you can get treated. So that is what I'm telling people right now. Have a plan with those 4 things.
And that breaks it down so nicely. And I think one of the things that you also reminded everyone is how important it is to have your connection with your medical provider. Everyone needs a health home, a medical home. And through those relationships with that provider is to find out where you are and where you can make your plan. So could you just, again, can you repeat, what are those 4 things that people need to be focused on? And we're going to grab this, and this needs to become part of our talking points. So what are the 4 things that we all need to arm ourselves with as we think about, in particular, is shattering to hear the uptick of how it's affecting our little people?
I love talking about these 4 things because these are real practical tools that you can do at home. So number 1 are vaccines and boosters. This is a really good time to get your flu shot. It's a really good time to get the bivalent COVID booster. So everyone ages 5 and up should be eligible for this booster if it's been 2 months or longer since your last COVID shot. So number 1, vaccines and boosters. Number 2, keep a supply of well-fitting masks at home so that if you do get symptoms, if you're coughing and sneezing, you can put a mask on, you can stay at home, and that way you're not exposing other people. Number 3 is keep a supply of over-the-counter tests at home for when you need them. Now, one of the things I want to remind your viewers is that Michigan insurance companies, including Medicaid and Medicare, are by law required to provide 8 free over-the-counter tests per person per month. You can also get free tests at places like libraries and YMCAs. So keep a supply of those tests at home for when you need them. And lastly, talk to your doctor to find out if you are eligible for COVID or influenza treatment, so that if you do get sick, you know where to go and you know how to access treatment.
No, that's really helpful. I'm wondering, I'd like to pull a thread that Dr. Abdul El-Sayed talked about when we talk about health equity, and that we know that a state and all throughout this country, communities that had already been experiencing health disparities, whether it's high rates of diabetes, heart disease, we know that environment and asthma is much higher amongst particularly Black and brown people and low-income people. So have we figured out, or what would you say to us about how we need to be thinking not only in regard to COVID, but our health overall, as it looks like I'm hearing you say that we've got COVID, but now we have this whole set of other diseases that may be connected or not, but we've seen these upticks. What do we need to be mindful of as we stay focused also on our everyday health in order not to succumb to COVID or these other respiratory diseases that you've mentioned?
One of the things we saw with the COVID pandemic is that whatever problems were there in society, COVID made those worse.
Yes.
So if there were health disparities, COVID made them worse. If people were feeling anxiety and depression, COVID made that worse. If there were issues with substance abuse or whatever the problem was, COVID made all of those problems bigger than they were before the pandemic. So it exploited the disparities that we have already in our communities and widened those disparities. And one of the things we saw when I look at the data, and one of the things that pains me the most, is how much our communities of color were impacted by that first wave of COVID.
Yes.
When we look at death rates, African Americans were disproportionately affected by COVID-19 and were dying at much higher numbers.
Mm-hmm.
And so to me, there are two messages in that. Number one, all of the tools we have, we need to make sure that our communities of color have access to those tools. And that's for COVID, right? That's to keep them safe for COVID.
Right.
But the second part of it is we need to make sure that everyone's health status is brought up to the same level. So that means whatever we're talking about, whether it's nutrition, whether it's exercise, whether it's diabetes, heart disease, high blood pressure, we need to bring up all communities to the same starting point so that the next thing we are facing, the next disease we are facing, it doesn't take those disparities that already exist and widen them more. So we've got to work on minimizing those disparities and bringing everyone to an equal starting point.
Yes, thank you so much for talking about that. And certainly with your leadership, the leadership of the Lieutenant Governor, we're really proud of the fact that while we were horrifically impacted, particularly Black and brown communities with COVID, the way that the state rallied in those first 6 months to a year made a huge difference. And in fact, as we know from the report, that significantly diminished the number of deaths and sickness that we've seen in Black and brown communities. Can you share with the audience and our listeners, though, okay, people say, okay, that's fine, but what's happening in my neighborhood? What's happening in my resources? Dr. Bagdasarian, can you talk a little bit, how has the state helped to get resources, programs and assistance out in places like Detroit, whether it's FQHC, schools? What's out there? What has the state done? And what do people need to know about so that we can connect to it?
So there are a lot of resources that have specifically been made available to folks living in Detroit, specifically communities of color in Detroit. And there are a couple of things that I am very proud of. Number one, Ms. Lily, as you know very well, we've got our neighborhood sites, which have been something that were really championed by the Racial Disparities Task Force. And these were sites in not just Detroit, they're in some other areas as well, but these are in socially vulnerable areas where there are folks living who maybe don't have access to a primary care doctor, who maybe don't have access to immediately call someone and get the help that they need.
Yeah.
So they started off as testing sites in community buildings. So maybe in a church basement, for example, they started out as testing sites, and then they morphed as the pandemic went on. They then became vaccination sites.
Yes.
And they have now become test to treat sites. So you can now go there, get tested, and then if you qualify for a therapy, you can immediately get a prescription for one of the medications that we have for COVID-19. So these are becoming holistic care centers for COVID-19. And we've got 13 of these test to treat pilots in different areas of the state, but many of them are in the Detroit area. The other thing that we did was we partnered with Detroit Public Schools to bring vaccine to Detroit Public Schools and to make those available. But we're not done, because unfortunately what we are seeing is that still with vaccines, we have disparities. Even though the access is now there, you can go really to any pharmacy in the state and get a vaccine. You can go to a number of healthcare providers. You can go to any local health department and get the vaccine. We are still seeing disparities. And that means it's not just about accessibility. We've got to start thinking in new ways and incorporating vaccines into the places where people want to get them. And one of the things we have been hearing a lot, especially from parents living in Detroit, is that they want to get their children vaccinated at their doctor's office. And so that is the next hurdle, is how do we get COVID vaccines incorporated into some of these medical areas where people feel comfortable with their pediatrician, their primary care physician, and they feel comfortable with the relationship and want to get vaccinated there. So we've still got work to do. We're not done yet.
Boy, do we have work to do. And as you said, we've also got to help more parents that are aware how important well child visits are and getting their children to pediatricians, into that nurse practitioner. So some of it is message changing too, isn't it? But I'm wondering, one of the things that we've been understanding is not only have we seen the kind of a flat line around vaccines, but also the issue of immunizations. Could you talk a little bit about the importance, particularly because you've traveled internationally? Those of us who've traveled internationally, we've seen the impact when children in particular don't have a regimen of immunizations. Could you talk about that briefly? And then we want to see if we have some questions from the audience.
One of the things that we have seen, unfortunately, with the COVID pandemic is there is an increasing distrust of the medical community and of public health. And we've seen vaccines drop across the board. Routine childhood vaccinations that I think many of us in our generation got. Now, many of the younger generation, people are not vaccinating their kids. And it's an unfortunate thing, because I think if anything, the pandemic, when I look at the data, the pandemic showed me how amazing vaccines are. And one of the things we are seeing is now diseases that were removed from circulation, diseases that we don't have to worry about today, like polio, are making a resurgence because folks are not vaccinating their kids. And this issue is only going to get worse if we keep heading down this road. And one of the things that really breaks my heart is some of the places I have worked in the world, there are folks out there who would give anything to vaccinate their kids. They would give anything to have availability of these vaccines. And it will be heartbreaking if we see a resurgence of things like polio and measles, which can cause horrible outcomes for children. Polio causes paralysis. Children can get horrible scars from measles. Children can even die from measles. So we need to really make sure that we're having these discussions about why vaccines are still important. And I think a lot of the conversations need to be one-on-one, and people are asking for these conversations to happen with their healthcare provider.
Yeah, so thank you for making that point about one-on-one. The messenger matters. The messenger matters. So we've got to do a lot more for people to understand that Black and Brown people have been involved in the development of these immunizations or vaccines, and not only the development of the science, the distribution, because it's understandable. We have a reason to have a history of distrust of the medical system. But now we recognize that we have people at the table making these decisions on our behalf. And just one last question as we get ready to go into a holiday period. What are the things that you're recommending that we're mindful of, particularly in less than a month? We're going to have folks, the biggest day in plane tickets and everything is going to happen. People are going to be in airports, people are going to be on buses around the Thanksgiving time. What are the messages that we need to be thinking about?
So really, really good question. can I just go back to the vaccine thing real
Yeah.
quick? Because I wanted to just add something. You said it so perfectly that we have folks at the table who are designing and making these vaccines, and there is real reason to distrust based on history. When we think about some of the historical wrongs that were done to Black and Brown communities, one of the things I just want to say is one of my promises to you all, to all of your viewers, is that I, number one, I don't take money from pharmaceutical companies or any outside interest, and I will never recommend something that I don't feel comfortable either taking myself or giving to my own family. So I am not going to recommend a vaccine that I don't feel comfortable taking myself or giving to my own child. And I just want to make that promise to you all, because I strongly believe in walking the walk. So I'm not going to tell people to get a vaccine if I don't feel comfortable taking it myself. And moving on to the travel thing, which is another great question. It's that same have a COVID plan. So, you know, people want to gather. And this is, I think we're out of the time where we can say, stop gathering, stop meeting with your loved ones, because it has been a long 2.5 years. And it's time to start making those connections, but to do it in a safe way. So again, having a COVID plan, making sure you're up to date with vaccination and boosters, that is the biggest thing that you can do to protect yourself and others this holiday season. Now, if you want to wear a mask, if you're traveling to a high-risk area, a high-risk part of the country that's in a CDC orange color, and you want to wear a mask, absolutely. I still wear a mask when I'm flying, when I'm traveling, because I'm exposed to a lot of people. I've still got my little bottle of hand sanitizer, and I'm hand sanitizing as much as I can. I still like to make sure I'm in a well-ventilated space if a lot of people are coming together. But the best thing you can do is do those 4 steps to have a COVID plan, which is vaccines, keep a stash of masks, keep some over-the-counter tests, and talk to your doctor to see if you would be eligible for therapeutics.
I love that. 1, 2, 3, 4. And Dr. Bagdasarian, you'll appreciate this. So guess what our next segment is? It's early childhood. And the reason why I'm kind of tickled about this is because the reality, well, tickled and dismayed, I'm both. I'm tickled because you just gave us 4 steps. And the reality is, and we know when we work with young children, we always try to make it simple. 1, 2, 3, 4. And so I want to thank you so much for being accessible and reminding the community that you walk what you talk. And we're going to ask you to be back with us again, because we are in this work together to make sure that Michigan is healthy and that all Michigan can move forward in a healthy and equitable way. Thank you so much.
Thank you, and wishing everyone a healthy fall and onto a healthy holiday season. And thank you for letting me come on and speak today.
Thank you. Thank you for answering the call. And so with that, I am happy to bring back Rita, our colleague, and from Chaz. And oh, please forgive me, I forgot to lift up Chaz to Dr. Bagdasarian, but I know that she knows your work and the work of Dr. Bilbina very well, because you guys too have been on the ground providing resources to the community all the time before COVID, and we'll be doing it afterwards. So I'm handing it to you to bring on Adrienne Mong, who is going to share some really important pieces that, as we think about our little people, the future of our city and the future of our world. Rita, I'm handing it to you.
Thank you, Jametta, and thank you for lifting up the work that our organization does. Thank you so much. Today's guest to talk about early childhood education is Adrienne Mong, the director of the Office of Early Learning with the City of Detroit. Thank you for joining us today, Ms. Mong. Adrienne, is that okay?
Yes, it's Adrienne is fine. It's actually Manja with a soft G at the end, but yes, Adrienne is fine. We are on a first name basis here.
Thank you, thank you. So can you please tell us what the Office of Early Learning is all about? What are you all doing to collaborate with systems, initiatives, and other programs that focus on early learning?
Yeah, absolutely. Would it be okay if I share my screen?
Yes, I think you have access to do that.
Okay, wonderful. Okay, so thank you so much for the introduction, and thank you so much, Jametta, for the invitation to be in this space with you all today. As was shared, my name is Adrienne Monge, and I serve as the Director of the Office of Early Learning. This is a relatively new office to the City of Detroit's government. So we sit in the mayor's office in the City of Detroit, and our goal is to ensure that Detroit becomes a family that puts, or excuse me, a city that puts its children and families first.
Right.
Yes, yes. So our goal is to really take Detroit from recovery to renaissance. We want to make sure that we make the investments in early childhood that are necessary to create the conditions, not just for our providers to thrive, but also for our children and families to thrive. We know that strong cities are built on strong neighborhoods, and strong neighborhoods are built on strong families. So we are currently seeking a $6 million investment in our early childhood landscape. And we know through research and existing policy that we will see an incredible return on that investment, not just in terms of outcomes for children and families, but also in terms of our community, our economy, and opportunities for Detroiters in the future as well. So our theory of change is really rooted in strengthening families and strengthening the opportunities that individual families have, and believing that those impacts will continue to level up and proliferate as we strengthen the opportunities for families and children here in the city of Detroit. So the current need, as we understand it, is very massive, and these numbers have only been exacerbated by the COVID-19 pandemic. So currently there are about 52,000 children ages 0 to 5 in the city of Detroit, and of those, we estimate about 37,000 need care based on workforce participation. We currently have enough slots in our early child care system for 18,500 children, which means we have another 18,500 children who need care but don't have access to that care or anywhere to go. This means that we have over 12,000 parents here in the city of Detroit who would like to be able to access the workforce, but are not able to adequately access workforce because they don't have consistent care for their children. And we all know, if you have worked with young children, if you are a mother yourself, if you do not know that your child is somewhere safe, you certainly don't have the confidence to go to work, right? So in order to understand what it would really take, right, to create seats, it's not simple. This is a very multi-pronged and multifaceted approach. And right now, workforce challenges are one of the biggest challenges impacting our ability to create capacity in our early childhood system. And low wages have really been a key factor in those staffing issues. So this is an area that we view as critical in terms of making impact for our early childhood landscape, and is one of the key work streams that we will undertake. So during the COVID-19 pandemic, there were many studies conducted and quick, outreach and research related to the early childhood landscape. And at one time, as many or nearly half of our providers indicated that they would close if they did not receive some kind of assistance. And even now, we are still struggling to get the workforce necessary in order to open every classroom here in the city of Detroit. So even though we do have these 18,500 licensed seats, the reality is many of those seats still are not full because we don't actually have a teacher or an assistant teacher in those classrooms to properly care for those children and facilitate their learning. So in terms of what it would actually take to close this gap, we have conceptualized these numbers because we need to know what it will take to get us across this finish line. So in order to close the seat gap here in the city of Detroit, we are looking at the need to establish or expand 290 additional facilities for childcare. We will need 1,300 new lead teachers and assistant teachers to staff those classrooms, and we will need 1,300 classrooms themselves. So in order for us to begin building capacity, we are really thinking about 4 critical work streams that we are looking to impact in order to create capacity in our early child care system. So the first is business supports. We need to ensure that every single existing child care business in Detroit has opportunity to perform at its highest capacity, has access to the knowledge and resources that they need to thrive and to expand if that's what they're interested in. We need to make sure we are investing in current and new facilities in the city of Detroit. We want to make sure that we have inspiring environments for our children, and that there are safe and inspiring environments for children and families as they are finding access to care. We also know that workforce and talent pipelines is going to be critical to actually adding capacity to this landscape. It's great if we have new facilities, but if we don't actually have the teachers to staff those facilities, that investment ultimately won't matter. And last, we are working to impact our child care subsidy system. So in the state of Michigan, our state does have a system that is intended to defray the cost of care for families. However, there are millions of dollars sitting at the state that are not being used. And so we need to understand the barriers that are keeping families from adequately participating with that system and using those resources, and also advocate for changes to that system so we can ensure that this is a system that truly works for Detroit, for our families, and most importantly, for our children. So we have undertaken the charge to collaborate across the city of Detroit with various departments. So in addition to seeking the direct investments in business supports, workforce development, and early childhood facilities, we are also looking at where there are opportunities to change policies and create the conditions necessary for our children, families, and providers to thrive. So an example of this would be we're currently working with BC at the Building Safety and Engineering Department in the city of Detroit to look at the process for licensing, and if there's anything we can do to streamline that process or resources that we can put out that would make that easier for childcare businesses that are looking to get off the ground or looking to expand. We are also working with Detroit at Work and DESC to establish some new workforce pipelines and secure funding for over 100 new CDA certifications over the next 2 years here in the city of Detroit. We've been able to work with Detroit Economic Growth Corporation to secure 14 facilities awards, 7 at $50,000 and 7 at $25,000 over the next 2 years as well. We will continue to work across city departments and within and outside of the city of Detroit's governmental infrastructure to align our resources and again, make sure that we are all moving towards that North Star of ensuring Detroit becomes a city that puts its children and families first. So ultimately, we think about this plan and what we believe we can accomplish together in the next 2 years. We know that we can support over 100 community-based childcare providers with business planning, coaching, workforce development, financial support. We believe with the direct investments in partnership with the Detroit Economic Growth Corporation, we can improve 30 existing facilities. We can help open 10 new facilities, open 50 additional classrooms, recruit and place 20 new lead teachers, have more than 50 newly recruited CDAs into the workforce, in addition to an additional 50 CDAs being funded for those existing in the landscape, and ultimately with the end result of creating upwards of 2,000 seats in Detroit's early childhood ecosystem. So this is the work we are undertaking in partnership with many. We believe that individually we can contribute to closing more than 10% of the city's seat gap, but we are also not alone in this work. Detroit Parent Network, Hope Starts Here, and many others are also executing plans to address this gap. And so we know that together, while this issue is complex, it is one that we can solve in partnership with one another.
Well, thank you so much for that information. It's very, I'm very happy to hear all of that. I am a mother, they're older, but they did go through they did attend early childhood education. And so I'm excited to see how other parents will be able to benefit from the services. But today, I think we wanna help you get the resources out to the community about the subsidies, break those barriers of access. Like, can you tell us what are the resources available that families can tap into if their income doesn't meet the federal guideline? What can they do? And what are those resources that you mentioned?
Yeah, absolutely. So actually, we are launching an effort today. Our kickoff is this evening in partnership with Detroit Parent Network for an event called DPN Enrolls Detroit. So this is a big part of the work that we are undertaking to make sure that every family has what we would call sort of a social navigator, someone who can help them understand all of the moving guidelines and qualifications for the different types of subsidized care, help connect them to other existing resources here in the city of Detroit. So there are different scholarships that are available for families, workforce programs through individual neighborhood and community organizations. And so our goal is to make this process as easy for families as possible by just connecting with them, building that authentic relationship, establishing trust, beginning to understand their needs. And then on the back end, we are doing the resource coordination necessary and just helping make sure that they are getting what they need, with the end goal being actually getting enrolled in a seat here in the city of Detroit.
Well, thank you so much. That is wonderful to hear. And again, I look forward to hearing more about how those plans are coming to fruition, and hopefully pretty soon, so that our families can take advantage of those resources.
Yes, and Jametta did drop the information for this evening's event in the chat. We would love to see you all there.
Absolutely. Thank you. We're going to announce that real shortly. So again, thank you for joining us. We're going to, I don't think we have any questions for the audience. So we're going to go ahead and let you go on to continue your day. We appreciate your time and the information.
Thank you.
Okay, and thank you, Rita, and Adrian, thank you so much. And we're really hoping that, I love that very first slide where you talk about a renaissance, and that now we have a recognition. Rita, think about this as a mom and so many others. There's a recognition finally with the business sector, with our government, and many more. What many of us have been saying, if we're not helping our babies come here healthy, if we don't love on them with quality early childhood experiences, they are not going to be able to learn. If they can't learn, they can't achieve. And when they don't achieve, then our city can't, and our state can't move forward. So, you know, a lot of us are real excited to see the efforts that are now being made to focus and support families around early childhood. So, shameless plug. Join us this evening, and we'll keep it moving. Rita, did we have any other questions before we shift to beginning to wrap up the program?
I don't think we have any more questions.
Okay, so with that, we've got some really great announcements. We've got cool stuff as always going on in the city of Detroit, as well as the metro area, and we want to make sure that you know about it. So I'm going to ask and hand it right back to you, Rita, to go ahead and share some of this great information for us.
Of course. So first off, we have a Detroit map of the early voting locations. So check that out on our screen. And if you want to look at it more closely later on, you can go to detroitvotes.org. And also, most importantly, you can remember that our next town hall is Thursday, November 17th at 12 p.m. Please put that on your calendars today so you can join us next month. And then we have the school board forum on October 20th. 18 individuals are running for 4 seats on the Detroit Public School Community District Board. This election will happen on November 8th. And 482 Forward is hosting a school board candidate forum. Get registered now so you can get updates on the candidates. Detroit Parent Network is hosting Detroit Parent Network Enrolls Detroit today at 4:30. We have the information on the screen, so please go learn all the information that they have and become a amazing parent and get those resources out to people. We also have Empowered Parents Sun. Let me skip. I think we are showing something.
I just didn't have a flyer.
Okay. No worries.
Sunday.
Okay. So Empowered Parents Sunday on Sunday, November 13th, citywide faith-based organizations. And join Detroit Public Television on Monday, October 24th at 7 for a live interactive community conversation on gun violence prevention as part of Detroit Public TV's Black Church in Detroit initiative. You can join the conversation live on Detroit Public Television's Facebook page or on YouTube channel, and let your voice be heard. And Chaz Center, we want to invite you, our community, to join La Vida Partnership, bringing hope to survivors of domestic violence at their trunk or treat event. It is family friendly, free, and open to the public. It'll be on Saturday, October 29th from 10 to 11:30. Individuals can wear purple to protest domestic violence, or they can dress up in their favorite Halloween costume. But most importantly, please join us to learn about the work that La Vida is doing to end gender-based violence in our community. And finally, our partners, Urban Neighborhood Initiatives, they're hosting their spectacular Halloween party. Join you and I as they host their 25th anniversary Halloween party on Saturday, October 29th from 12 to 3. You and I will have activities for the whole family, and they will include a trunk or treat, food truck, community resources, face painting, and an ofrenda to honor Dia de los Muertos. And that concludes our activities and events happening in the community. Jametta, I hand it right back off to you so you can close up.
Okay. Well, I really hope that everyone has a sense listening to Rita and seeing those slides, that there are resources in this city that help to build up our families, that help to build up parents to be champions, and help build up businesses and all of us who care about each other in our future. And know that having information by trusted sources, facts, not fiction, not just what we've seen floating throughout social media, but facts matter, and trusted voices matter. And we hope that you understand and know that we are in the journey with you to raise our hands in power for our vote, and raise our hands in power to protect our children and to be safe. And so let everybody that's been part of our COVID313 community town halls, you got to come off of just being a name on Zoom. Let's see your faces. Oh, here comes the gang. I love it. I almost want to say like the gang. And just let you know, everyone, how much we appreciate you. And I appreciate all of you that we've been working together to love on our community together. So with that, Christina, Adrian, everyone that's been part of this work, take care, stay safe, stay strong. Okay, bye-bye. Take care.